Okay, so now we're going to talk about caring for children in diverse settings. And this chapter talks about taking care of patients in the hospital, in the community setting, talks a little bit about home health, also talks about family-centered care and coping mechanisms for kids in the hospital. So I want you to pay close attention to the developmental references that it makes. In the chapter, which we'll go through here in a few minutes, you'll see a couple of different areas broken down into infants, toddlers, preschool, school age, and adolescents. Pay close attention to those two areas. Reasons for most kids in the hospital. I think we talked about this in a previous session as well. Most of the time with the younger kids, it's respiratory diseases. The older kids usually you can't, you see a lot of respiratory admissions for asthma or for pneumonia or for trouble breathing. You see some mental health problems. Um, I think like the 5 to 12 age group, a lot of admissions for mental health problems. So there's some reasons for the majority of them. Different types of admission. You can either have, an admission for an illness. You could have a surgical admission. Over in the chapter, it does talk about preparing your child for hospitalization, and that really only applies if you know that it's an elective hospitalization coming up. A lot of times there's no way to prepare a kid for hospitalization because it's an acute onset of illness, and you just don't have that time to prepare. All right, there's a lot of extra information in a lot of these slides, so we're just going to go through and hit the high points. One of the big things about a hospitalized child is you've got to build that trust relationship, and that's the same way with everything. To get a good assessment, you have to get your patient to trust you. So building that rapport and building that relationship is the foundation for a good experience for everyone. We're not going to go over the steps of the admission process, but again, communicating age appropriately, building that relationship. Some psychological effects of hospitalization on kids. Anxiety, fear, it just depends on their age. A lot of it is developmental level specific, and you'll see that talked about as well. Infants have, the 9 to 12-month-old, lots of separation anxiety. Older kids have, they withdraw sometimes, they miss their peers. So again, it just depends on their developmental level, how they react to hospitalization. It also depends on their previous experiences. A lot of times you'll see kids come into the doctor's office or come into the emergency department and just scream and cry because they know that last time they were there, they got blood drawn, it hurt. They relate that experience to this experience. So their previous experiences do come into play. If they're a chronic kid and they're in the hospital a lot, this may be old hat for them. So a lot of different things factor how they react. When you have an infant and or a toddler and you're talking about separation anxiety, there are 3 stages. And I guess any child can have some separation anxiety. First, they're going to throw a fit. They're going to protest. They're going to cry. They're going to kick. They're going to scream if mom and dad leave. Then they just kind of become withdrawn. That's despair. They just kind of sink into themselves. And then if they're left alone long enough, which unfortunately some of our patients are, parents just kind of drop them off, and it's kind of sad. But they do, if they are separated long enough, then they do form some detachment. They kind of figure out that the staff is their friend and mama and daddy may or may not be back tonight, so they have some detachment issues. Now, you talk about patient-centered and family-centered. Families react differently to hospitalizations and illness as well. A lot of the way that they react depend on if they've been in the hospital a lot, their parenting style, just how they react to stress, how they cope. If they're chronic patients, like I said, Their reactions are all going to be different. You're going to run into every family dynamic you've ever thought of in pediatrics. We're going to skip through there. Some things that help kids cope with hospitalization. Now, pediatric hospitals are amazing in that they provide a lot of activities for kids in the hospital. Child life specialists are wonderful in providing all of that distraction and education at the kids level. Some things to promote coping that you can do as well. Deep breathing techniques, distraction, bubbles, books, TV, music. We have therapy dogs at Cook Children's. There's always activities going on, even for those kids that may be in isolation that can't come out of their room. A lot of the child life specialists will figure out something especially for them. So I've seen, we had a little kiddo that had a femur fracture while he was in traction, and they're in the hospital a long time. And they would just take his whole bed out and push it down into the lobby or to the atrium when they had events down there, and you'll see hospital beds with kids in traction down there participating in all of the events. So it's really great. Okay, we're going to skip through the questions again. Some things to reduce stress in kids during an invasive procedure. Now, a lot of the units have like a treatment room, and I would definitely recommend, if it's going to be a traumatic experience, if there is a treatment room available, you may take the child over there to do whatever traumatic procedure you have to do. If not, definitely get Child Life involved or someone else to distract the child, either TV or an I Spy book or something like that. But there's some ideas in here that you can use as well. Let's skip through the questions. During hospital stay, you of course have to promote safety for your kiddos. Now, I'm going to give you a helpful hint. Those of you that are paying attention will get this question right on the exam. Okay? The most important thing during a child's hospital stay is the safety of the child. Okay? Save the baby. Just remember that. You'll thank me later. All right, unfortunately, sometimes we do have to do restraints on kids. Fortunately, it's very infrequently, but there's a lot of documentation and a lot of assessment and a lot of rules that go with placing restraints on patients. So make sure that you know what your facility's policy is. It may or may not coincide with this particular policy, but you need to know what your facility requires. Of course, you have to document a reason, and you have to try everything that you can not to put these kids in restraint. If you have tried everything and this child is just not going to cooperate or is potentially harmful to himself, then you may have to apply a restraint. These are just kind of general guidelines. You need a written order for a license from a doctor within an hour of application, and then you need a face-to-face evaluation by your doctor within an hour of application of the restraint. So those are just kind of general. There are very specific policies in each one of your facilities, I promise you. All right, when you have to take a patient to x-ray or whatever, make sure that you're safely transporting. I wish we had some little buggies like that. That was a pretty cool car. All right, some information about discharge teaching, discharge instructions. Of course, discharge planning begins at admission. You need to make sure you have all your ducks in a row when you send your patient home. Good teaching, follow-up appointments, when to contact the doctor, when not to come back, when to come back, any medications that they may be going home on, any school notes, etc. More and more, you're seeing a lot of care take place out in the community. We have community health-based nurses. We have school-based clinics that have a nurse practitioner staffed by a nurse practitioner. They take care of a lot of our kids. One of the biggest things to remember and to promote with the community-based nurse, community-based care is the whole idea of a medical home. You've got to have someone that coordinates care for your patients, even if it's a well child that's occasionally, that's, very infrequently hospitalized. They need a medical home to manage, to assess their development, to manage their immunizations, etc. They need to have a hub. All right. More and more, you're seeing our sicker kids go out into the hospital or to the community. A lot of that is, insurance won't pay for them to be in the hospital that long. Hospitals are full. Parents want the kids home. So, and we don't, being in the hospital, of course, sets kids up for infection and even adults. So you want them in their home environment as soon as you can get them there for more than one reason. We have a lot of outpatient procedures and a lot of ambulatory care, like the urgent cares and things like that. They are well equipped to do pre-op teaching, prep, do surgeries on the outpatient, in an outpatient status. So you'll see more and more of that. And you notice teaching is on here. They do a lot of teaching at those facilities as well. They also do a lot of follow-up, like they'll call and check on families, which I love, the next day and make sure that they're doing okay, etc. Home health care. There is a big pediatric population in the home health care industry. There's a lot of chronic kids out there that have a nurse that comes to see them 2 or 3 times a week. Those kids with trachs, with home vents. There's a lot of chronically sick kids at home out there that need nursing care. So home health care and pediatrics is a big thing. Lots of education, lots of home environment assessment. Unfortunately, sometimes lots of CPS involvement as well. So the home health nurse really monitors the whole family situation, home environment, etc. Okay, and there's just some more information on home health care and some advantages of home health care. You get the kiddo home sooner, decreases the stress on the family. Parents can go back to work if they need to, and the patient's in their own familiar setting. And there are some disadvantages. A lot of times cost is an issue. Insurance may or may not cover it. So, there may be some downsides as well. Now, again, family-centered care. You'll see that term a lot, and you may see that term on a lot of exams. So know the proper interventions for family-centered care. First, you want to assess. It's just like the nursing process. You want to assess what's going on in your family, what they need, any knowledge deficits. You want to teach them about their illness. You want to include them in the care planning. And you want them to be hands-on, dressing changes and tube feedings. You want the family to do that, even in the hospital setting. So that's what we're trying to transition them home to do. So they need to be involved in the hospital as well. New diabetics, totally get the family in the care team, on the care team for that. They are going to be managing this child's chronic illness, so they need to be the ones managing it at the time of discharge. We just talked about community-based centers. All right, so now let's go over and let's look at the chapter and see if there's anything else in here we need to discuss. All right, these little videos, this first one is like a 17-second one. I wouldn't waste my time watching that one. And this one does talk about care of the hospitalized child, but it's more focused on pain management. So I would go ahead and watch it, but you can apply the information in it to your pain in children section. Good information. Okay, so how do kids react to hospitalization? Again, anxiety and fear, separation anxiety in the infants. Sometimes they just withdraw into themselves. Older kids have a loss of control because they can't, if they're driving, they can't go somewhere, or they can't, they do lose that control. School, they miss their peers, etc. All right, here's one of those areas, like I said, that has broken down into infant, toddler, preschool, school age, and adolescent. Read through this section. How do they react according to their developmental level? Very important information, and pay special attention to the boxes. Good information. Okay, a lot of it is based on previous experiences. Like I said, if they had a procedure that inflicted pain, they're going to remember that procedure, even if they're 2 or 3 years old. They will scream at you when you come to do their blood pressure. So make sure that you take that into account. How do parents respond to child's hospitalization? Lots of different ways. Again, you're going to see many different family dynamics, anger, guilt, all that's going to come into play. Parents, siblings, especially if there's a new, like a critical diagnosis like cancer or a terminal illness. Siblings, real important to address the siblings' needs as well. There are different activities for siblings to do while their brother and sisters in the hospital. There's also different agencies that'll like the warm place. If you have a patient die, they interact a lot with the siblings of the patient to help with coping, help with therapy, and things like that. Alrighty. Nurse's role, again. This talks about preparing, if you do have that luxury, to prepare your child or a child for hospitalization. Then there's lots of different things you can do. You can give them a tour of the hospital. You can let them play with the equipment. There's lots of different things that you can prep them to reduce their anxiety and help with their coping. There's about 3 or 4 tables in this chapter that have some really good information. Unfortunately, they're kind of placed in areas that they don't really fit. So here's some things to reduce fear of once the child is in the hospital, things to help with their coping. So if you're doing a procedure, make sure you describe it on a developmental level that they understand. Now, I'm going to give you a helpful hint. If you have a 5 or 6-year-old, 7-year-old, and you're going to have to do something like a painful dressing change or something like that, say that's 9 o'clock in the morning and you're going to have to do that at noon, don't tell the kiddo that until it's time. I made the mistake one time of going in first thing in the morning and telling my patient, this is when I was in nursing school, telling my patient, hey, at 12 o'clock we're going to do this, and this was a really painful dressing change. So I had a really long morning that morning because this kid was just freaking out about having to do this procedure at noon. So choose your words, choose your timing, make sure it's the best for everyone. Don't keep things from them, but reveal them at the appropriate time. There you go. That's a good one. All right. Here's some other techniques that you can use to kind of help minimize stress and anxiety of the hospitalized kid. Again, a lot of it is very kind of a no-brainer, just getting them involved in their care, letting them touch the equipment. Be careful with your medical terms. Don't use the whole, we're going to poke you in the arm, or there's certain things that kids take very literally. So be careful with your words. All right, again, some teaching guidelines to kind of prep your child for hospitalization. Of course, they tie everything to the National Patient Safety Goal. This is talking about medication. When they're admitted, you get a good medication reconciliation. And then when they're discharged, if they go home on any more meds or different meds, you want to include those in their medication list. Okay, this just talks about different departments or different healthcare settings that you might be coming into contact with. PICU, sometimes it's a different environment up there in the PICU, so make sure that parents are prepped for that. If their child must go to the ICU, a lot of it is, it's very intense up there. It's light pretty much all the time and lots of activities. So make sure you prep your parents for a stay in the ICU. They're already nervous and anxious enough, so knowing what to expect would be great. Isolation rooms. This is a tricky one. With kids in the hospital, you have a lot of kids that are in isolation. And if they're in isolation, they can't come out and visit the playrooms, or, they have to wear a mask when they're even out in the hall. So this can be a little tricky one. You've got to figure out how you're going to keep that kid from feeling isolated, even though he truly is. So child life is very helpful there. Involving the parents, again, very helpful. And you need to provide them with some activities like everyone else gets, only theirs going to be more individualized because theirs are going to be in their room. They have Xboxes, they have different game setups that they can take into the room. So just be very cognizant of those kids in the isolation room. Don't make them feel, for lack of a better word, isolated. Again, here's some more teaching techniques, or some more techniques to minimize their separation anxiety and their loss of control. Lots of helpful hints in all of these boxes. This is another area that talks about the developmental levels: newborns, toddlers, preschoolers, school age, and adolescents. Once they're in the hospital, these are some ways to deal with each one of those age levels. Good information to know. Hint, hint. All right, if you have a child coming in for surgery, now the surgery centers do a really good job with this. We had a surgical procedure and they were wonderful. They let Tyler play with all of the equipment, and they gave us a tour of they said, okay, here's pre-op. Back behind these doors, the operating room, can't go back there because it's all sterile, and this is where he'll recover, and this is the waiting room for you. And so real thorough explanation of everything to us and to him. All right, this table is especially good to know information. Talks about safety and ways to promote growth and development with your hospitalized children, and again, broken down into age groups. You'll see that throughout the text. They try to address how it affects each developmental level, how each, like when we talk about pain, you'll see that it's broken down by developmental level. So that's a hint that you need to kind of learn the information like that. Pre-op teaching, again, broken down by age levels. Here's our little baby in our crib. Wish we had cute cribs like that. I really like that. Talks more about restraints. Here's some things that you need to document with restraints. And of course, always refer back to your institution's policy. It supersedes anything in this book. There's some different types of restraints. You'll see the elbow restraints, we call them no-nos. If a child has an IV and you want to keep them from, picking at their IV or pulling their IV out, you can place one elbow restraint on, and that's not considered an actual restraint. But if you put two on, then that is actually considered a restraint. These are weird little restraints. I've never seen one like this, like the jacket restraint. Never seen one. Here's some more good information on restraints. If you go to work in a hospital, even in an adult hospital, you always have in-services and new documentation and things, learning modules on restraints. So you'll get that in your orientation when you go to work as a nurse. Some more information on transporting, bathing. Kids still need baths when they come into the hospital. So usually the parents take care of that if the parents stay there with them. If not, that is our responsibility as nurses to make sure our patients get bathed and their bedding gets changed, etc. Nutritional care in the hospital. Hospital food historically has not been very good. However, I think that's getting better. We actually have, I think, room service type situation at Cook, and they can order up whatever they want whenever they want. It's not a bring your tray around type of breakfast, lunch, dinner time anymore. So that has really helped with making sure our kids making sure they eat when they're in the hospital. Really important. Here's some ways to promote nutrition. Talk about favorite foods. Make sure they always have plenty of liquids, etc., etc. Now, once they're in the hospital, this is the section on therapeutic play. Play is very important to kids, so we need to make sure we provide opportunities to do that. If we have playrooms and the kids can go to the playroom, that's fabulous. But if they are in isolation or if they're immobilized, we'll have to bring the play to them. A lot of times that's how they cope, is with playing. All right. Therapeutic play, there gives you a definition of therapeutic play. Schoolwork. A lot of hospitals have a school or an ISD that is associated with them. If you have children in the hospital that are going to be there for a long time, CF patients are usually, cystic fibrosis patients are usually admitted for a couple of weeks for a tune-up. So they're going to miss some school. A couple of different options. The school district can supply their work and supply someone to come up and, like say, if my kiddo was ever hospitalized for 2 weeks, Joshua ISD would provide somebody probably to come up there and bring his schoolwork, etc. Or they have the option of transferring if they're a Fort Worth ISD. In the Fort Worth ISD actually has a school, quote unquote, room up on site. So they go to school for a few hours in the morning and they come back and get their treatments and eat their lunch. Then they go back for a few hours in the afternoon. So keeping up with that schoolwork is really important for two reasons: keeping up in school and keeping that child socially involved and on track. There's another little video right here. Most of these are pretty good. You can tell that they are a couple years old.
Caring for an ill child present.
I'm not going to go through the whole thing, but good information. They're little shorties, worth watching. All right, providing child and family teaching. Discharge teaching, teaching about procedures, teaching on, I keep coming back to the new diabetic, lots and lots of dietary teaching, lots of home care teaching, how to give your insulin shots. That's patient teaching and family teaching. You want to get the patient, if possible, to be really involved in their care. you have to promote that autonomy if it's about developmentally appropriate. Discharge planning begins when? Upon admission. So you start planning to go home when you get in. You need all of the information about medications, like we talked about, follow-up information, notes for school, etc. And again, if they go home on any new meds, you need to make sure that that information goes home with them as well. All right, community care. We talked a lot about community care. Community-based nursing, school-based nursing, lots of responsibilities being shifted out of the hospital and out of the acute care setting into those community-based spaces. Lots of education done out there, lots of screening done out there. School nurses are one of the biggest players in the community-based nursing setting. Let me go down to the school nurse section here. All right. Now, I remember when I was in school, the school nurse used to only put a Band-Aid on a boo-boo. Not the case anymore. When you guys hit community health, the majority of our community health placements are with school nurses, and you will find out how busy these guys are. They take care of some very sick kids. Chronic kids go to school, need their tube feedings, need their breathing treatments, need their, it's not just passing out ADD meds anymore. So these school nurses work really hard. They deal with a lot of sick kids. In addition to taking care of acute care emergencies, they do a lot of work with chronic kids. So they're busy people. All right, let's see what activities of the school nurse. A lot of screenings, the vision screenings, the scoliosis screenings, lots of lice checks. They are aware of the growth and development things. If they see something that raises a red flag, hopefully they communicate that information to the parent or to the care provider. A lot of times there is a nurse practitioner on site at the school, so they have kind of a go-to person. Unfortunately, they are the discoverers of a lot of abuse, sexual abuse, physical abuse, emotional abuse. So they do have to report that. With the bullying and the suicide risks and things going on, school nurses are often the very first ones to notice those things. So if you're ever a school nurse, or if you are a school nurse, or if you work with a school nurse, you need to be kind of on guard and notice these things in your kids. It says it's definitely changed over the years. Yes, it has. I have all kinds of respect for school nurses. They also deal with a lot of individualized health plans. I think they're called 504s. If you have a child with a chronic illness, you go through the school and do kind of a care plan for them, with contingencies on, they may be able to leave class a little bit early, or be able to go to the restroom without asking, or things like that. So they do deal a lot with that. If you have kids with food allergies, they're responsible for the EpiPen if anybody happens to ingest peanuts and they're allergic to peanuts. So lots of busy stuff going on in the schools nowadays. All right, and this just talks about home care, and we've talked about that. And this lady's blue hair is very interesting. Yeah. Okay, let's see if there's anything else in here we need to touch on. Here's our wonderful care plan. At the end of each chapter there is a care plan, and I would definitely recommend looking through the care plan, taking note of the interventions, and some of the nursing diagnosis. I don't really test over nursing diagnosis, but it's good to know the interventions that apply for each one. So the interventions are very important. And then you have your key concepts at the end and some more questions. So that wraps up this chapter. You all have a good night.